So here's a little demo of what the term unwinding looks like in my manual therapy practice. It's a term that gets used in many different ways. So this is not an attempt to revise anyone else's definition, but to try to provide a general definition which I think is very useful. And to me, unwinding is a semi-involuntary, spiraling or undulating movement along the axis of one axis of the body. Often it's the body's midline, but sometimes it's the axis of a limb or the axis of a gliding joint. In this case, I've got a patient here who has a history of some whiplash injury. Nothing acute, but some limitations in range of motion and the occasional nerve entrapment symptoms down the arm. So there's cause for caution, and there's great cause for trying to build trust, both conversational trust with words, but also autonomic trust. This organism should have ways of communicating with me without words, right? So now let's establish that trust a little bit. So I've asked my patient to give me the weight of her head. I'm also going to now see what the safe range of motion is. So we want to look at sort of what passive range. So we're just going to explore, and you let me know if you feel any discomfort at all, right? So here we are going into side bending. And I feel a little bit of resistance here at end range. Does that feel okay?
It feels okay.
Okay. And going in the other direction like that. How's that?
A little discomfort.
A little discomfort. If we start back at neutral and then go only this far, does that feel okay?
Mm-hmm.
So if we go into like 25, 30 degrees of right side bending, that still feels comfortable. Beyond that, does not feel great. So that's going to be our boundary on the right here. Okay. How about rotation? If I turn to the left,
that's okay.
that feels fine. So I felt that resistance and it feels fine. And how about turning to the right? Feel some resistance there. Does that feel okay?
It's okay, but not like it can go much more.
Okay, so let me back off a little bit. Is that even more okay?
It is, yeah.
Okay, great. Now let's just explore up into flexion here. How's that? Up through there?
All right. A little bit of stretch.
Okay, stretch, no pain.
No pain.
Okay, and how about if we go behind the plane of the table? Just let your eyes and jaw relax, and how does it feel to go in through here?
A little bit of compression on that.
Okay, if I come out of that a little bit like there.
That's more comfortable.
Okay, how about over here?
I got a little bit of sensation, not terrible.
Okay, so how about if I only go this far?
Yeah, that's fine.
Okay, great. So we've now explored, and what I'm visualizing now is sort of a conical space with a little bit of a bite taken out of the right side of that cone, which is an area that I'm going to avoid taking my patient's neck and head into. And the idea is to not create a perception of threat, right? Notice that when I'm holding the head here, I'm supporting it with my own poise in my stance. If I ever feel like I'm lifting from my shoulders, I want to reset my seat and lift from my own pelvis and heart. Okay, so here's the deal now. We're going to play some human Ouija board, okay? And so what I want you to do is to relax as much as possible. And if there's tension left, that's fine. And I too am going to go into a listening mode. And so both you and I are going to try to get out of the way and let your neck reflexively guide us. What does the passive autonomic neck have to say? And so from a practitioner perspective, what I'm trying to do is seek a sense of neutral. But neutral turns out to be a moving target. And that's the key. I bring the head and neck into a position that feels like all of the opposing forces fall away. But once I find that open, easy place, it escapes from me again. And then I have to go looking for it. It's like chasing some magical spirit through the dark woods. I have to continue to seek neutral. And so what emerges as we do this seeking behavior is the process I call unwinding. And I'm showing you a slow and subtle version because this is a neck that has sustained a little bit of injury. There are versions that are a little bit quicker. But always, always there is respect for the intelligence of this body to know where it wants to go. And there is even in medically complex situations, there's a sense of play here. A sense of play. A sense of, I wonder what'll happen next. And I'm not going to be too attached to what I think it is. I'm going to stay with the leading edge of the moment. Stay with the emergent quality. And if this were a real life session, I would probably do slightly less talking. But only slightly. Okay.
Not any other way.
Yeah. You still doing okay there?
Yeah, I'm just dandy.
Great. And what begins to emerge after 30 to 90 seconds of this kind of spiraling dance, this feels pretty safe for me so far, is you begin to notice autonomic change. You begin to notice changes to the breath rate, changes to the temperature of the skin, changes to the heart rate, the muscle tone, the level of conscious arousal in my patient. Are they falling asleep on me? Are they going into a dreamy state? If I'm able to produce signs of autonomic calm, I know I'm on the right track. If after 30 to 90 seconds I'm not producing calm, I still feel like I'm just wrestling with something that's very taut and defensive, then I know I'm missing something. I'm failing to communicate something. Or maybe it's just not the right time. So don't do this forever just because I told you to. Do this and stay open to the feedback from the organism, verbal and nonverbal. And for me, there's this continuous letting go of what I think it should be doing, allowing it to be where it is. And what it's saying now to me is, Mike, stillness. Mike, hang out here. Another feature of this motion in the neck and along the midline of the body that you will often encounter is that the fulcrum of where the motion is happening is mobile. So sometimes I feel that the head and neck are pivoting around the upper cervical segments. And other times the fulcrum feels like it's in the lower neck or in the upper thorax. And sometimes you can follow things down. It feels like the whole neck is orbiting around a fulcrum halfway down the spine. And so there's this constant sense of a moving pivot point. And this is why we use the metaphor of unwinding. Unwinding a bit of yarn or a wound thing. You don't always have the same point from which things unwind. You have to stay open to where it is now. So with that kind of a dance, and checking in on the person's conscious experience, you know, I'm just noticing a lot more fluidity in the resting tone here. Are you feeling okay overall?
Yeah, I feel good.
Feeling good. Do you mind if we just check your range of motion? Okay, so we noticed some decent limitation past about 25 degrees of lateral flexion. So if we just explore to the right now, tell me the first time you feel any discomfort.
What about there?
Okay, so we've gotten to like 35, 40 degrees, maybe even 45 degrees of right lateral flexion. We've gotten a significant change in right lateral flexion. How about rotation to the right?
About there.
About there. Also better. So what happened there? The short answer is I don't know. The long answer is I have many ideas. And so this is why we're going to do a whole class on unwinding. Its best practices, its best potential theories for what's going on in the body, and ways of being safe with this complex dance between practitioner and patient. We're also going to be talking about how to do something like what we just experienced, but with ourselves. So this is going to be not just about unwinding other, but unwinding self. So that's why the class is going to be open to any embodied practitioner, movement, somatic, manual, etc. Thanks for listening, and see you next time. All right.
That was good.